Hello friends, in this session we are going to read not just about all the government new health scheme, but all the image based question from the health program part which can come in your upcoming exam. So let's start with this very first program, Ayushman Bharat Digital Mission. It looks like Ayushman Bharat, but you can see the disconnection between. So it's a very fine difference. If you look at this logo, this is Ayushman Bharat Jan Arogya Yojana or Ayushman Bharat. And now with the 5 leaf, which is in this logo. Why 5 leaf? Because to remind you that the insurance is of 5 lakh, and so 5 leaf. So this program is an old program, Pradhan Mantri Jan Arogya Yojana, Jai Ho PM ki, in which 5 lakh insurance is there. Is it for BPL family or economically weaker section? It is for economically weaker section family who are earning less than, you can say, less than 10,000 per month. And along with EWS family, the new thing which is done under it is for all the people who are more than 70 year or equal to 70 year Indian, they are also included under this program. And they call it Vayo Vandana. Vayo Vandana. Vayo means old age. Vandana means worship. So for the worship of old age, Vayo Vandana Yojana, they have included the same insurance of 5 lakh insurance, 5 lakh per year per family. Insurance is now also given along with EWS family to more than 70 year people, and we call that PMJ, but in PMJ they have included this part Vayo Vandana. So this is PMJ where there is no break in the circle. But if you go to our first program, this is Ayushman Bharat Digital Mission, in which the circle is getting crossed. So this is a fine difference, you have to focus here, and we call it ABHA. So what is this ABHA? ABHA is again AB stand for Ayushman Bharat. So that's the same AB. And HA stand for health account. So in this Ayushman Bharat health account, now government is suggesting that all the people should put all their investigation, they should have all the reports in this health account software, and they can also get benefit of medicines. So medicine can be available on phone, like we have app for medicine like Tata 1mg app and all. So similarly here also on this ABHA app, we can in future maybe ask for online supply of medicine from the government. Okay, so this is for medicine supply or medicine support also. Okay, now for the medicine support, there is also one more program which is known as PM Jan Aushadhi Yojana. Jan means people, Aushadhi means the medicine, and Yojana means the program. So under this Jan Aushadhi Yojana, of course, what government is doing, government distribute medicine or give medicine at 30 to 50% cost. But actually government can procure medicine at 5-10% cost. So here also government is earning money, but at the same time it is helping people also. So this is Jan Aushadhi, whose shop you can see in the government hospital campus also and at many place. Jan Aushadhi is for medicine distribution. ABHA is for keeping the health records of the citizen, and Ayushman Bharat Digital Mission is having this health account ABHA. Ayushman Bharat health account. Now let's focus on this part of Ayushman Bharat one more time. When you look at Ayushman Bharat, it has 3 components. First is PMJ, which now also include more than 70 year people, which has 5 lakh insurance per family in secondary and tertiary care. Second part with PMJ is health and wellness program in the school they have added. So school health program also come under it. And along with the school health program, the third thing which come under it is Ayushman Arogya Mandir. So these are the 3 things. PMJ is the first component, school health program is the second component, and Ayushman Arogya Mandir is the third component. Ayushman Arogya Mandir is same as health and wellness center. But now PHC is known as Arogya Mandir, sub-center is also known as Arogya Mandir. So there is no more PHC and sub-center. This PHC and sub-center is now renamed as Ayushman Arogya Mandir. Okay, and they can give you logo of Ayushman Arogya Mandir also. They have given it already in the exam to identify. So let me show you the logo of Ayushman Arogya Mandir. This will be the logo thing that they will give in the exam. And there's some leaves are there. In this logo, they are saying that we are distributing medicine to old age people, BP, sugar medicine in Ayushman Arogya Mandir. But they can have this Ayushman Arogya Mandir part, and they are saying in the Arogya Mandir, what is Ayushman Arogya Mandir? Mainly government is saying that we will take 1.5 lakh sub-center and some PHC, and we will change them into Ayushman Arogya Mandir. So in the Ayushman Arogya Mandir, they will have health awareness. Along with health awareness, medicine distribution, teleconsultation, immunization, yoga meditation, and maternal health. So this is the 6 component which they can ask which component are there in the recent Ayushman Arogya Mandir. So let's revise the 6 component. What are the 6 component? First, A for awareness, A for awareness. Then there is, after A, there is medicine distribution. So medicine is anyway given, we all know, medicine distribution. Then there is immunization, which is also a old work done under sub-center and PSC for a very long time. Then maternal health is also an old work done there. We of course conduct delivery at PHC and type B sub-center. Now, and we do ANC checkup. So maternal health is there. So medicine, distribution, immunization, maternal health, they are all old 3 component. New 3 component that they have added is one component of health awareness. Then the second component is of teleconsultation, consultation on phone. And the last and most important thing they have added is yoga and meditation. Because yoga se sab hoga, hai na? Yoga will do many work. So they have included these 3. So medicine distribution, immunization, maternal health, 3 old thing, and 3 new thing: health awareness, teleconsultation, yoga and meditation. For this health awareness, they have created a new post at Arogya Mandir. The name of the post is CHO. बिल्कुल सही सुना आपने, CHO है. What is CHO? CHO stand for Community Health Officer. So this Community Health Officer will be posted, where he will be posted? At Ayushman Arogya Mandir, and at that Ayushman Arogya Mandir, this community health officer has these 3 main role: health awareness, teleconsultation, and motivate people for yoga meditation. Okay, so do remember. Now, other than that, other than this Ayushman Bharat program, which has this 3 component, one more question came here is, Ayushman Bharat is centrally sponsored or state sponsored? So many students, they think Ayushman Bharat is only funded by BJP. No, Ayushman Bharat has 60 to 70% fund coming from center BJP, and remaining 30 to 40 both the funds. Similarly, the ESI scheme, which is for factory worker, and Food Safety Standard Authority of India, which look over food adulteration, these 2 are also funded by center plus state. So in 3 program, ESI, FSSI and Ayushman Bharat, center state both give fund. Do remember. Now, this PM Ayushman Bharat also have this one more thing, health infrastructure mission. In this health infrastructure mission, they are saying that we will update, we will do renovation of hospital. So that is health infrastructure mission. They will ask it in the full form. Wherever you see AB means Ayushman Bharat, health infrastructure mission, HIM, health infrastructure mission. Do remember the full form. Then the digital health mission, we already saw the digital health mission, which is having which card? ABHA card, Ayushman Bharat health account. So that is ABHA card. And there is this mission Indradhanush, was an old program. Now it is Intensified Mission Indradhanush 5.0, which include all the vaccine. Previously it was only for 7 vaccine. When Mission Indradhanush started, it was for diphtheria, pertussis, tetanus. Then the 3 vaccine given at birth, OPV, BCG, Hep B. And for these 3 vaccine which are given at birth, ASA do not get paid. ASA do not give vaccine theoretically, but she get paid for all the vaccination. Why? because she act as motivator. She motivate the mother and take her to vaccination. So why she is not getting money for these 3 vaccine? Because these 3 vaccine are given at birth, and at birth mother and mother-in-law both are in the hospital. So whom the ASA will motivate? Father-in-law, hai na? Sasurji, hai na? There is no one to motivate, so ASA do not get money for these 3 vaccine only: OPV, BCG, Hep B. And the last 7th vaccine in Mission Indradhanush earlier was measles. But now Mission Indradhanush is no more. Now we have Intensified Mission Indradhanush 5.0. And in this Intensified Mission Indradhanush 5.0, we cover not just this 7 vaccine, but all the vaccines which are in the National Immunization Schedule. Okay. So now let's move to some more new program other than the Mission Indradhanush part and Ayushman Bharat Arogya Mandir part. So, as I was saying, one more part was Ayushman Vayo Vandana card. Vayo means old age, Vandana means worship, old age worship. So under this program, what they are doing to all the people who are more than 70 years, they are getting 5 lakh rupees. And if there is a elderly in the PMJ family, economically weaker section family, they will get 5 lakh extra for elderly people. So if you are a economically weaker section family, 5 lakh is for whole family. But if in your family there is an old age also, then you will get 5 lakh for the family plus 5 lakh extra top up for the old age person. So now it can be, you can say it is 10 lakh like that. Okay. So it will be cashless treatment at impaneled hospital after hospitalization. This word government do not tell, but this card is useful after you get admitted in the hospital bed. Before that, all the cost of medicine, OPD, investigation, you have to bear from your pocket. And a real poor person will not be able to bear that. But it is only after hospitalization that this card work, and it work in secondary tertiary care hospital. So this is the newer thing under Ayushman Bharat. Now let's talk about Mission Nari Shakti. This Nari Shakti will have this logo, female hand closed, Mission Nari Shakti. And under this Nari Shakti, they have 2 things, Sambal and Samarth. Sambal means there will be safety and security is Sambal. Helpline number is 181. And Samarth means they will have the Swadhar Grih. Swadhar Grih means with land, government will give them a home. Ujjwala is where they give the cylinder, and working woman hostel will be there. So what are the 2 parts? Sambal and Samarth. Now let me help you understand and remember this part, Ujjwala and Ujjawala. Ujjwala is where government give LPG cylinder with one-time gas only, no refill. With one-time gas for BPL family. So remember, Ayushman Bharat is for economically weaker section, but Ujjwala is for BPL family. And the real confusion arises when they talk about Ujjwala and Ujjawala. Ujjawala. So how to differentiate it? Very simple. When you look at Ujjawala, you can see a jaw here in Ujjawala. Or what is the function of jaw? Jaw catch food and bring it to the stomach. So similarly, Ujjawala is to prevent child trafficking and help in their rehabilitation. That is Ujjawala, like a jaw. It is catching children and bringing it to the stomach. So prevent child trafficking and help in their rehabilitation. Okay? And rehabilitation. Chalo, so this is Ujjawala and Ujjwala. I think you will never forget the difference. This is Sambal and Samarth. Samarth will have cylinder, home, and some job, and the hostel. That is Samarth. Samarth means capable, empowerment. And Sambal means safety. So what is the number of women safety helpline number? 181. Plus Beti Bachao, Beti Padhao also come under Sambal means safety. So these are the new thing under Mission Nari Shakti with one hand you can see there. Chalo. Now, so these are the women focused health scheme where they can ask separately the thing. One is Pradhan Mantri Matru Vandana Yojana. Matru means mother, Vandana means worship, and Yojana means program. So under this mother worship program, Government of India say that we will give 6,000 rupees to mother. In this 6,000, first 2,000 rupees will be given as installment at 12-week pregnancy, when mother will come for first registration. Then next 2,000 rupees will be given at 6-month pregnancy, so that she can take care of her nutrition. And last 2,000 rupees is given at 6 weeks after delivery, when she will come for first vaccination of their children. And now one vaccine is after birth. Second vaccine which we give at 6 weeks, for that mother will come and she will get 2,000 last. And at this time we can also insert IUCD. IUCD can be insert up to 6 to 8 weeks after delivery. So this time is a very good time for inserting IUCD also. So total is 6,000 rupees. But tell me one, my friend, have you seen in any state money given to pregnant female before delivery? Money is given after delivery under JSY. That incomplete mother and child, I will show you in this session only, is Pradhan Mantri Matru Vandana Yojana Mother Worship Program, 6,000 rupees. Remember the duration. Then in the Janani Suraksha Yojana, money is given after delivery if the delivery occur in the hospital. And in the Janani Shishu Suraksha Yojana, Janani means mother, Shishu means child. So if you see child or Shishu keep on doing susu, susu means urine, hai na? So in the logo of JSSY, there will be mother and child, but the logo will be of yellow color. Why yellow color? Because the Shishu is doing susu. And so like that you can think and you can remember that the child logo of JSSY will be yellow color. And there will be 3 things free here for any day of the month. Free delivery, free treatment and C-section, and free ambulance. Plus there will be free food also for mother and one attendant. This free food will be for 3 days if it is normal delivery, and it will for 7 days if it is C-section delivery. So what are the 3 free things under JSSY? Free food, free ambulance, free treatment and drugs. This free food, 3 day normal, 7 day C-section delivery. Now, one more program is PMSMA, Surakshit Matritva Abhiyan. I will show you the logo. Surakshit means safe, Matritva means motherhood, Abhiyan means mission, safe motherhood mission. So under this program, government is giving ANC checkup free on 9th of every husband, and he do not took me on 9th. So can I go on 10th and do my ANC checkup and investigation on free? Answer is yes. Under JSSY, JSSY or JSSK is the same thing. Janani Shishu Suraksha Yojana and Janani Shishu Suraksha Karikram, they are the same thing, JSSY or JSSK. Under JSSK, female can have free ANC checkup, treatment, investigation on any day of the month. And even very long, for last 30-40 years, it is free in every government hospital, free investigation, treatment on any day of the month. So in PMSMA, Pradhan Mantri Surakshit Matritva Abhiyan, government gave something free on 9th, which is free anyway on every day of the month. And so they actually just gave nothing on 9th, and I just say something free on 9th, which is free on every day of the month. This magical program is Surakshit Matritva Abhiyan, Safe Motherhood Mission. Now, next is Poshan Abhiyan, which is focusing on nutrition, of course, nutrition of pregnant women and children. And then there is Sukanya Samriddhi Yojana. Sukanya is the good daughter, Samriddhi is the wellness, and Yojana is the program. So it is a saving program for girl child, Sukanya Samriddhi Yojana. So now let's move to some more new program. This is One Health program, very likely to come in this upcoming exam. What is the purpose of this One Health program? One Health program is to prevent pandemics. Okay, how? It can prevent pandemics by preventing and regularly checking diseases in animal also. Okay, because there are many diseases in animal which can then occur in human. Corona was also like that. It first occurred in animal, then went to human. Similarly, the epidemic of H1N1 swine flu influenza virus also came from chicken to human. So if you are checking for disease in animal early by doing surveillance about it, that if there is any sudden rise in the number of cases of animal dying, You can report it by this surveillance system and you can prevent pandemic. So disease in animal, one thing we are doing to prevent pandemic. Second thing we all are doing is focus on environment, that how can we make the environment suitable for living and less suitable for pandemic. Okay, so if there is biodiversity loss, deforestation, air pollution, water pollution, climate change, that also come under One Health program. If there is intensive livestock disease vector, okay, or antimicrobials and all those things, they also come under it. So there's a lot of things which come under One Health. And the logo you have to focus. One Health logo is a heart. In that heart there is plant also, a boy playing, and a pig also. Plant, pig, and a boy playing. In that logo, One Health program. So this is a new thing. I hope you will remember. It is mainly to prevent pandemics. Now, one more thing which has done is this vaccine has been launched. Right now, Nikhil was saying it to me that her wife, who had delivered 2 children, she was asking that government is giving some vaccine to prevent from cervical cancer. So what is the name of that vaccine? Cervavac. Cervavac. And a cervical cancer vaccine, Cervavac. And remember, it's a quadrivalent vaccine. It has 4 quadrivalent human papilloma vaccine. I'm sure out of this 4 strain, 2 must be HPV 16 and HPV 18, because HPV 16 and 18 are the most common strain. And they will use the long one subunit, L1, L2 subunit they use to make the vaccine. So this is quadrivalent vaccine. If it is Gardasil, in the Gardasil vaccine, which is also quadrivalent vaccine, they have HPV 611 along with HPV 16 and 18. So this is also quadrivalent like Gardasil. And how to remember it? If you add 6 and 11, 611 becomes 17. So it's 16, 17, 18. The time when you had your first crush. Oh, sorry, second, third, fourth crush. But remember, out of this 17, 1 is 6. 1 is 6. Then only you can remember 6, 11, total 17, and 16, 18. So this is a quadrivalent vaccine launched. Name is Cervavac. What is the age when we give it? It is given between 9 to 14 year. Between 9 to 14 year age child are getting it. And they are getting it 1 dose. Okay. So do remember about this vaccine. If you found E6, E7 subunit in anyone blood, this subunit indicate high risk for cervical cancer. So if in the blood you found E6, E7 subunit, high risk of cervical cancer. Acha, one thing you can see here, very debatable thing. They have written cervical cancer is amongst the commonest cancer in India. Amongst the commoner cancer, not commonest, commoner. So if I ask you this question, what is the most common cancer in females of India? What will be your answer? Will it be cervical cancer or will it be breast cancer? Answer will always be breast cancer, never cervical cancer. And if I ask most common cancer in world, then answer will also be the same, breast cancer, not lung cancer. And if I ask most common cancer in female of world, then also the answer will be breast cancer. So in this 3 question, the answer will be breast cancer. Now you will ask, sir, why? Why breast cancer is more common, not cervical cancer? Because in breast cancer, people survive for longer time. And at any time, if you are measuring burden of total case, prevalence means new plus old case at present moment. How many of the total people are suffering at present moment? And this prevalence is incidence into duration of disease. Incidence means new case, and it is directly depend on duration of disease. Duration of disease means for how long people are suffering. We all know in breast cancer, people can survive for 5 year, 10 year, 15, 20 year also if they are selective estrogen receptor modulator, like HER2, NEW2 receptor are there in the breast cancer. then by using selective estrogen receptor modulator like tamoxifen, we can save them for 10, 15, 20 years also. So the duration is too high, and because duration is high, at any time, their total case will be high. Ask this question from your 10 friends. How many of them has a relative with breast cancer and is still surviving? 1 or 2 will say yes. In a class of 100, usually 8, 10 people say yes, we have some relative with breast cancer and is still there. So in the prevalence, we can have all of them. But ask the same question from a batch of 100 students. How many of you have any relative with cervical cancer and surviving? Answer will be 0 or 1 hardly. How many of you have a lung cancer in your relative and surviving? Answer will be 0. Because lung cancer and cervical cancer, within 1-2 years, patient die. Duration of lung and cervical cancer is very less. So at any time, if you measure the total case will always be bigger for breast cancer. So remember this point, don't doubt it. It is a direct data from the table in Park textbook of preventive social medicine. So no matter what medicine, surgery or any other person tell you, remember this: most common cancer in female of India is always breast cancer. Most common cancer in female of world is also breast cancer. Most common cancer in world is also breast cancer. But if they ask most common cancer in male of India, then answer will be oral and lip cavity cancer. क्योंकि ऊंचे लोग ऊंची पसंद मानिक चंद और बोलो तो बोलो जुबां केसरी, क्योंकि मुंह में रजनीगंधा कदमों में दुनिया. These are the ads they made to sell this tobacco product. And if someone came with a swelling in the mouth, you will put 2 fingers. Where? 1 finger inside mouth, 1 finger outside, and you will palpate the swelling. This is the screening test for lip and oral cavity cancer. If you found a smooth swelling, it is cyst. But if it is rough, it is cancer, because cancer has abnormal growth. So rough swelling on palpation by 2 fingers is the screening test for lip and oral cavity cancer. NEET question. I hope you will remember it. So this is the data which is given in Park textbook. If you doubt the data, I will love you for that, because always trust evidence, not expert like me. We can be wrong, but you have to trust the book. So this is my phone number. If you have doubt, message it on me and I will share you with the table of this Park on which they have given this data. One more thing I want to tell you. Many people will tell you wrong that ASA minimum education is 10th pass. Always wrong. Park has written in 3 places, ASA minimum education is 8th pass. So why those teachers are teaching? There is 1 ASA per 1000. That's the recent update. One teacher again wrongly said 2 ASA per 1000. That was our future goal. Government said, let us first do 1 ASA per 1000, then we will think about 2 ASA. So this is there. And how much money should be on health? WHO say 5% GDP should be on health. But how much government of India is giving on health? 1% GDP India gives on health. And this money which India is giving on health is same for last 1990 till 2026. And that's why I say to all my students, don't support either the Congress or the BJP, because they both are not giving money on health and education. Okay? And due to which a lot of mother and children are dying in the referral, due to which our rural health is very much compromised. And so this is the question from this topic. I hope you will. Now this logo can come. This is Central Health Education Bureau with a flower. This is a new logo. I hope you will remember it. Central Health Education Bureau. Then for the cervical cancer, we discussed the vaccine. But remember, January is cervical cancer awareness then. And they have a new kind of logo for cervical cancer. They call it Tully. Tully means it is green plus blue. So the logo of the ribbon is green plus blue. That is Tully in cervical cancer. If it is pink color ribbon is for breast cancer awareness. And if it is red color ribbon is for National AIDS Control Organization. But this cervical cancer has Tully logo. Now, as I was saying, in the Ayushman Bharat, they have included a school health program. Earlier, a school health program used to come under PHC. But now, a school health program come under Ayushman Bharat. Why? Because in the school health program, on every Tuesday, they will celebrate Health and Wellness Day. Tuesday will be Health and Wellness Day. Okay? Mandir word in Arogya Mandir, which is the Health and Wellness Center earlier. So remember on Tuesday, and this is Health and Wellness Day. Then in the school health program, One more thing is they will have thematic assembly on some theme of adolescent. They will do the assembly, thematic assembly on adolescent topic. Okay, this type of thematic assembly can be conducted every week, or the government say at least 14 day they should have this thematic assembly. And then in the school health program, they also have to have once in 3 month review that they are applying adolescent program well or not. So review every 3 month about adolescent program action, every 3 month about adolescent program, ki the government is helping in applying adolescent program through school or not. Okay, so what they will do is they will choose one male and one female teacher as health and wellness ambassador, and they will choose one boy and girl as health and wellness messenger. So you might have seen this car ambassador in old age. This was the car, big car for politician. So ambassador is a big car. Ambassador is for teacher. Teacher will be health and wellness ambassador. And messenger are a small thing. So who will be the messenger? Boy and girl. One boy, one girl is student. So student will be messenger. Teacher, one male and female teacher, they will be ambassador. And no, they will not do couple yoga on Tuesday. They will motivate and train a student on yoga and meditation. Kyunki yoga se sab hoga. So on Tuesday, on health and wellness day, messenger which are student, ambassador which are teacher, they will try to motivate a student for yoga and meditation. Then once every 14 days, they will have adolescent thematic assembly on which they will talk about 10 topics related to adolescent nutrition, adolescent sexual health, adolescent mental health, adolescent drug addiction problem, and similarly things other. And then every 3 months, they will have a review meeting about adolescent work done in the school. So this is the school health program new thing. You have to remember, and remember the logo also. New logo there. Chalo. Now, we already discussed about National Digital Health Mission and ABHA. So in this digital health mission, they will have family registry, personal health record, e-pharmacy, DigiDoctor, telemedicine, and health ID card. These all things will be there in Ayushman Bharat Health account under National Digital Health Mission. So this is again one logo which can come, Gram Swaraj Abhiyan. Swaraj means independent ruling, and Abhiyan is mission. So in this Gram Swaraj mission, which they have written Sabka Saath, Sabka Gaon, Sabka Vikas, everyone village, everyone together, and everyone develop like that big talking. So this in the Gram Swaraj Abhiyan, what they focus on is, they focus on how to implement government program in villagers' life. Okay, so saturation model is there. Saturation model means every one family should have used maximum health programs benefit given by government. So saturation model means how can we make government health program used maximum. Every program should be used by every villager. Government health program used maximum by villager. This is the main focus of this Gram Swaraj Abhiyan. Okay, this is again new thing. Then which day is National Vaccination Day? They can ask. March 16 is National Vaccination Day. 16 March, 16 March. How will you remember it? 16 March. For me, remembering it is easy. My girlfriend, my wife's birthday is 17 March. So one day before is National Vaccination Day. You try out your own method. Okay, it's 2 days, 1 month after Valentine Day, like that you can see. And if you go 4 days before Valentine Day, this question has also came. 10th February, 4 days before Valentine Day, this is National Deworming Day. So what comes 4 days before Valentine Day? No, it's not Hug Day, it's not Love Day. It's Teddy Day. So what will you give to your Teddy on 10th of February? 1 tablet of albendazole. Because albendazole is given biannually, twice in a year. One on 10th Feb and other on 10th August. But 10th February is National Deworming. 16 March is National Immunization Day. So now, this is program where you can see mother and child together. This is Kilkari, not Pichkari, Kilkari. Kilkari is the word for first child cry. It is recorded messages on phone about child care. Okay, so what is Kilkari? It is recorded messages on mother's phone. If mother will give missed call on a number, she will get recorded messages on which thing? On child care. So she will listen to the phone, she will take care of the child. So easy. All pediatrician go for oil massage. No need, hai na? So just on listening to recorded messages, she can take care of the child. This is Kilkari. Very good thing. Now this is having only mother, only one girl, no child. So this is training program for ASA on phone. This is known as Mobile Academy. Okay. So ASA training on phone. And ASA will listen to it and she will get trained. All the trainer go for oil massage. No need. Just by listening, she will get the training. Now this is a Anmol program. If you look, focus here, there is a mother and child with green color logo. So it is Anmol because it is A&M online. So they call it Anmol, A&M online. What is this? This is a tablet based software which will be given to A&M for data reporting. So this software is Anmol A&M online. Do you remember green color mother, green color child? Never forget, tablet based software for A&M data entry. Okay, that's Anmol. Chalo. Next is a confusing program, Nikchay and Nischay. Just like Ujjwala and Ujjawala, Nikchay and Nischay is confusing. So this is Nischay. What is Nischay? Nischay is UPT kit, urine pregnancy test kit, which is given by ASA. This is Nischay. And this is Nikchay. Nikchay is web-enabled reporting and follow-up program for TB patient. If any TB patient came in private or government also, you can make the entry of that patient with full detail and you will get some money for referral also. And private and government both have to report TB patient under Nikchay. So now how will you remember Nikchay and Nischay? This is two. Nischay is UPT kit. So there was a student, Ayush, he's doing his physiology now from Armed Forces Medical College. He said, sir, it's very easy for me to understand because out of these two words, in which S is coming first? In Nikchay or in Nischay? You can see in Nischay, S is coming first. And from S, he thought S means sex. And from sex, if not protected, it will lead to pregnancy. And pregnancy will need UPT kit. So if S is coming first, S is for sex or UPT kit. So Nischay will be for UPT kit, Nikchay will be for TB. This is the thing which English speaking people can use. But for Hindi speaking, just understand the meaning and it will be simple. Nik means no. Chay means loss of body. That is Chay Rog. In TB, there is loss of body. So Nikchay is no TB. Nischay is a Hindi word which means to be sure of. So what the ASA want the mother to be sure of? They want them to be sure of their pregnancy. So Nischay, Nikchay. Now let's add 2-3 points here. One is, which is a recent update also, Nikchay portion. Nikchay, as I said, no, and Chay is TB. Portion word means nutrition. So previously under Nikchay portion, government was giving 500 rupees per month for TB patient nutritious food support. But now the government is giving 1000 rupees per month to every TB patient. Whether in continuation phase or intensive phase, doesn't matter. To every TB patient, MDR or normal, anyone. 1000 rupees per month to every TB patient. For why? Why? For nutritious food support. For supplementary food. So that they can buy some egg or something for their good nutrition here. So supplementary nutrition, they are giving this extra money, 1000 rupees per month in their account. So this is Nikchay portion. Then Nikchay is here, Nikchay portion is here, Nischay is the UPT kit by ASA, and the next thing you should know is PM portion. PM portion. What is PM portion? This is the program which replaced midday meal. So now midday meal is no more. You have PM portion, and when they were replacing it, they say we will do one more thing. Previously PM portion, previously when midday meal was there, they were giving half of protein and 1/3 of kilocalorie needed per day in the midday time. And why they were giving more protein and less calorie? Because you know, mother and children all over India are mostly eating rice. So they are not getting protein at their home. So in the school, they will give more protein, less calorie. So this was the food given. Earlier, this was given to school children. But now, along with school children during lunch, they will also give this food along with school children also for preschool children. They will give it not only for school children, but also for preschool children. So what do you mean by this preschool children? Those who go to Anganwadi, they are preschool children. Now you will say, but if they are not coming to school, they are going to Anganwadi, then why the government is giving them food in school? The reason is because under a new program, now all the Anganwadi government said has to be integrated with school. Anganwadi integrated with school under new government initiative. And that's why when they do PM Poshan give food not only for school children, but also for Anganwadi children now. They are mixing this. So when they talk about PM Poshan, they will talk about this program 5+3+3+4 program. What does this first 5? First 5 is 3 years of preschool, KG nursery, this is 3 year of preschool, plus first 2 year, this is 5 year. After first 2 year means first and second class. So after first and second class and first 3 year, 5 will be completed. Then next 3 will be third, 4, 5. Next 3 will be 6, 7, 8. And then last 4 will be 9 to 12. So this is 5+3+3+ program. And why Anganwadi is integrated with school? The purpose was simple, to prevent dropout. Because in the village you will see many people, they all get enrolled in Anganwadi because it's just giving food. But after Anganwadi, many of them do not continue till school. So there was a dropout. To prevent them, they said, let's integrate it together. One more recent question is from the kilocalorie and protein that they are giving in Anganwadi program. So if you look at every child, till what age children come to Anganwadi? Do they come to till 3 year, 4 year, 5 year, 6 year? Child come till 6 year in Anganwadi. And every child who come to Anganwadi, they will get some kilocalorie energy and they will get some protein per day. Similarly, we can talk about females. Females who come to Anganwadi can be adolescent, can be pregnant, lactating. These all female come. And then last we have malnourished child. So these are the people who come to Anganwadi. And see how easy it is to remember. The protein they get is 15, 20, 25 gram per day. So simple. 15, 20, 25, 15, 20, 25. And the kilocalorie they get is 500, 600, it should be 700. But because it's malnourished child, so let's give 100 extra, 800 kilocalorie per day. So 15, 20, 25, 500, 600, and then directly 800. You remember this 3 group who get the benefit, and then you can easily remember how much protein and how much kilocalorie they get. So this table is a recent exam table just last year. It can come again. Do remember it. Now, this was Nishchay UP Ticket by ASA. This was the incomplete program, Matru Vandana Yojana. Remember, for worship, we need only feeling, no money. Government is giving 6,000 under it theoretically. It has never landed in the reality yet. So this has half child, half mother. Incomplete mother child is PM Matru Vandana Yojana, PM worship program. Matru Vandana. Do remember. Then as I said, yellow color mother, yellow color child is JSSY, Janani Sishu Suraksha Karikram. Child has done the susu. This was a PYQ of NEET exam already, NEET 2024. So very likely to be repeated again and again. This has a black color mother, black color child. This is Lakh. Lakh means aim. So what is the aim of Lakh program? Aim is to improve facility in labor room, maternity OT and maternity ward. This is improving facility in actually all the area concerning to childbirth, labor room, maternity OT and ward. Okay, this is Lakh. Then, if you see white color mother, white color child, think about foreigner. This is the foreigner WHO program, Baby Friendly Hospital Initiative. And in this WHO program, Baby Friendly Hospital Initiative, do not focus on prevention of infection. Why they do not focus on prevention of infection? Because in US, UK anyway, prevention of infection is not a major problem. And they think if the child is getting mother milk, the child will fight with infection himself or herself. So this is for infection prevention. Foreigner program, WHO program, BFHI. Black color was for Lakh, white is for BFHI. Blue is for UNICEF. Again, you can see mother child here. And remember, UNICEF is the program which fund seed and manure of applied nutrition program. This question came in NEET exam 2022. And people think nutrition should be deal with food and agricultural organization. But no, it is UNICEF who gives seed and manure of applied nutrition program. They said in the school we should have green fruits and vegetable. They will mix it in the midday meal and they will get healthy. But one thing, fruit will not survive in school, and even if it survives, teacher will eat it first now. So this program never worked, but they have asked. Remember, UNICEF, blue color mother, blue color child, and fund seed and manure of applied nutrition program. This is red color mother, red color child, look like Holika Prahlad ko jalane le ja rahi hai, look like the mother is burning the kid itself. So that is the Anganwadi program, which come under ICDS, Integrated Child Development Scheme. This ICDS look over Anganwadi program. And Care Foundation fund ICDS. Because who need care the most? Children. How will you give children care? By giving them good nutrition and all. So Care Foundation fund ICDS, and this is Anganwadi logo of ICDS program. This is the hand of which person? Hand of Prime Minister himself. Remember this PM Matru Vandana Yojana, the PM Surakshit Matritva Abhiyan Safe Motherhood Mission, in which on 9th of every day, government was giving free NC checkup and treatment in government hospital, which is free on every day of the month. So do remember, on 9th, if they write 9th of month, which program is implemented? This is PM SMA, Pradhan Mantri Surakshit Matritva Abhiyan. Surakshit means safe, Matritva means motherhood, Abhiyan means mission. So this is PMSMA logo. So now let's revise all the mother-child logo one time, and then we will move ahead. I think you remember it. The black mother, black child is Lakh. But if they say white mother, white Lakh, which is improving maternity, OT, labor room. White mother child, what is that? White mother child will be Baby Friendly Hospital Initiative Foreigner Program. Green mother, green color child, Anmol. Blue color mother, blue color child, UNICEF. Okay. Then black, white, green, blue. Black, white, green, blue. More red color mother and child sitting in his lap is ICDS, Anganwadi program. Then you have incomplete mother and child. That is PM Matru Vandana Yojana. PM Matru Vandana Yojana. So these are the 6 programs with mother child. But if you see the child separate from mother, that is Kilkari. Kilkari must means first child cry, on which recorded messages there on phone, by which she can take care of the child. So I hope this mother child program will not do your maa bahan, it will not make you confused anymore, and it will be clear to you. Chalo. Now, if they say 2 children playing with leaf, this is Rashtriya Bal Swasthya Karyakram for children, under which Ayush doctor and nurse and A&M, nurse and pharmacist, they visit Anganwadi and government school and they screen for 4D. So they ask which program do not come under RBSK many a time. So Ayush doctor is going there with his stethoscope. If you need an instrument to detect the disease, then that will not come under RBSK. Therefore, RBSK don't cover all the diseases which need instrument. Like it don't cover congenital glaucoma disease. It don't cover means don't screen for. Because for congenital glaucoma, you need to measure the optic nerve thickness or eye pressure by gonioscope. You need the instrument. So it don't cover. Similarly, it also don't cover zinc deficiency. Because if there will be zinc deficiency, it will lead to chote tatte, hypogonadism. And I am 100% sure. One more thing which zinc deficiency will lead to is dryness around nose and mouth. This question came in NEET 2023. Dryness around nose and mouth is by zinc deficiency. Then one more thing which will lead to from zinc deficiency is delayed wound healing. All these 3 questions has been asked in 3 different exams. So I am sure you will write it correct. Zinc deficiency of course lead to acrodermatitis enteropathica. That means skin will be dry, and enteropathica means intestine will not be able to absorb anything. That's why zinc deficiency is causing all this problem. Okay. Chalo. Now, RBSK will have leaf. But if they say RKSK, Rashtriya Kishore Swasthya, Kishore means adolescent. So this is the program for adolescent. Because government think adolescent play kite, peche ladate hai na, they play kite or try to entangle with each other. So adolescent will have the kite and children will have the leaf. This program is saying health in your hand. Aapka swasth, aapke haath. Aapka haath, aapka swasth. Health in your hand means don't smoke, don't drink, health is in your hand. It cover diabetes, heart disease, cardiovascular disease, stroke and cancer also. So it is for 4 diseases: cancer, stroke, cardiovascular disease and diabetes. NCD program. This is the logo for National Mental Health Program. The last time when it came is 2017. And under National Mental Health Program, they have said suicide is no more a criminal offense. You can do suicide if you feel like, and police will not file a case against you. There should be no electric shock should be given. We should first assess the patient capability, that whether the patient can take decision or not, and then we ask for any advance directive, that is patient has written something in the diary or some place about his future treatment under the hospital, and then we ask for any nominated representative. Now all the sick person can write some representative who will decide for their treatment, and that's not a criminal offense anymore. So do remember this Mental Health Act. Many a time they ask the question from the cutoff for intellectual disability. Now we don't use the word mental retardation, because if you say someone as mentally retarded, they will understand. But if you say someone you are intellectually disabled, he will get confused. Are you calling me intelligent or what? Hai na? So they have used a confusing word, and they say start with 69 always. Hai na? Because if you are less than 69 or equal to it, then you can go for mild. So 69, less than 69, not equal to it. Hai na? Less than 69 till 51, it is mild intellectual disability. Then this is roughly about 20. And last, less than 20 is profound. So start with 60 and start with 69 always. And then last is 20. So first is 20, last is 20, profound and mild. In between, you have 2 things: moderate, mild, moderate, severe. So when they say moderate and severe, this will be of 15 only. So 51 to 15, that means 52, 36. And here it is 35 to 21. And less than equal to 20 is profound. So 15 in between, start with 69 and then last is also 20. Because psychiatry, PSM, they both ask questions from the cutoff. Do remember it. Chalo, next question. This is the one which I was saying you, that they can give you the full short form, Pradhan Mantri, or they will directly write Ayushman Bharat, ABHIM. HIM. What is HIM? Health Infrastructure Mission. HIM means Health Infrastructure Mission. In this mission, they will have improvement of hospital facility in urban and rural health and wellness center, and they will try to have critical care hospital in the blocks. Okay, so this is the planning of Health Infrastructure Mission. Okay, ABHIM. Then this was the question came in NEET INICET exam already. Tele-MANAS. This is the new portal where if you are feeling alone or depressed, you can call and you can get some help directly from the doctor. The helpline number you have to remember 14416. Remember the logo also. This is National Mental Health Program, Tele-MANAS. Okay, so you can call 14416 on this number, but if you wish, you can also share your problem with me also. I will just listen to it properly and I will ask what is the solution. Most of the time you know the solution, so I will just ask you and I will say do it. So just listening also help a lot. Do listen to your friend and remember the program Tele-MANAS. Okay, this came already in INICET exam. Then we read Nari Shakti, which was having the logo of female fist. Now one more thing is Swasth Nari Sasakt Parivar. That means healthy female, capable family. So under this, they are saying from 17 September till 2 October. How will you remember? Till Gandhi Jayanti, till 2 October. And 17 September till 2 October. That means that is for 15 days in a way. 15 days before Gandhi Jayanti. Before Gandhi Jayanti. So Gandhi Jayanti means Gandhi birthday is 2 October. So before 2 October, 15 day, this is the time when you have to focus on healthy female for capable countries. Swasth Nari Sasakt Parivar. And what they do it? They do screening of women for NCD under this program. Screening for hypertension, diabetes, oral cancer, breast cancer, cervical cancer. Okay. So this is Swasth Nari Sasakt Parivar. Okay. Chalo. Then this is the logo of National One Health Mission. I said they will give you a logo where a child is playing, then there is a pig, and then there is a child playing pig and plant tree. So that is the real logo. This is the logo earlier created, but now the real logo is the one I have already showed you in my initial part. This was the question in NEET exam. They gave the logo of Sapna. Sapna is the mascot of a program known as SPURS. SPURS program means healing touch. SPURS is a Hindi word which means healing touch. So this is for community awareness that you should not throw the leprosy patient out from the village. If they are taking regular treatment, after 2-3 months, they can be taken back in the family. So for that community awareness, we have this mascot, Sapna. Sapna is mascot of which program? SPURS. So if you see a child with two pony, a ponytail, two pony school bus, that is Sapna. If you see this logo where you can see one student told me, sir, in this logo, Congress and BJP, they are together. This is National Leprosy Eradication Program logo because we eliminated leprosy in 2005. So this is for eradication, and this came in NEET 2024. So I'm keeping it here. Both Congress, BJP, that's leprosy. But in the leprosy SPURS program, mascot is Sapna. Then this is Meena, the UNICEF mascot, and you can see only one pony, not two pony, and always there will be a parrot. That is the mascot of UNICEF program, Meena. Let's do some question also. What is the highest level of community participation? Only the question of recent 2-3 years. Highest level of community participation is when you involve community in planning of health campaign, plus who give idea. They have asked this question, that who give idea, community give idea, and who should implement it, community should implement it. Now you will say, if community give idea, community implement, what doctor will do? Should he dance or what? He have to act as a cement to bring the divided community together and let them work in harmony. So that's the work, but planning and idea both should be from the community. That is community participation. Then one more question is from urban health center part. Do remember, this is very important. MAS stand for Mahila Arogya Samiti. This Mahila Arogya Samiti is at 50 to 100 household. And Government of India think on an average in one household there is 5 members. So 50 to 100 household means I can say 250 to 500 population will be Mahila Arogya Samiti. Mahila means female, Arogya means free from disease, and Samiti means committee. So these are the female who are living in slum areas, and they will hold meeting every 2 weeks, once in a 2 week, and they will report to Usha. Who is Usha? Sister of Asa, urban social health activist. They have asked in the PYQ, what is the population now for USA? 1,000 to 2,500 population. USA report to urban ANM. Urban ANM is at 10,000 population. So in one exam they ask, which is not present in urban area? Is it sub-center or PHC or CHC? So remember, sub-center is not present in urban area. In place of sub-center, we have urban ANM. Okay, sub-center not present in urban area. That's why they have Mohalla clinic in Delhi, and Jayalalitha government have Amma clinic in Tamil Nadu for slum areas people, because sub-center is not there. So at least they should have some hospital. And now the BJP government is having Arogya Mandir in the sub-center area. So that is replacing the sub-center, those Mohalla clinic, Arogya Mandir, or the Amma clinic. So remember, which is not in urban health mission, sub center is not there in urban area in urban health mission. So urban ANM, they report to urban PHC. Urban PHC is at 50,000 population. Urban PHC report to urban CHC. Urban CHC is at 2.5 lakh population and it is 30 bed. But if you are at metropolitan city, of course, you all know, Kolkata, Chennai, Delhi, Mumbai and all, they have at urban CHC at 5 lakh population and they will have 100 bedded urban CHC. Okay, so metropolitan city will have CHC at 5 lakh, urban CHC at 5 lakh and they will be 100 bedded. So now how will you remember this population norm? It's actually very simple. Just focus for some 10 minutes. If you divide 2.5 with 5, 50,000, 2.5 CHC, 50,000 PHC. Divide 50 with 5, 10,000. That is urban ANM. Divide 10 with 5, 2,000. Roughly at 2,000 you have Usha. Because 1,000 to 2,500. Divide it 10,000 by 5, 2,000 roughly for Usha. ASA 1,000, Usha 2,000. But don't write 2,000 exam. Write 1,000 to 2,500. That's written in part. So 10,000 half 2,000. Half of 2,000 is 1/5 of 2,000 is 400. Roughly around 400 is mass. 250 to 500, roughly 400. So you just have to remember 2.5 for CHC and keep dividing them by 555. PHC is at 50,000. So you can see 5 urban PHC will be under 1 urban CHC. Urban CHC 2.5. So urban PHC 50, that means 1 urban CHC look over 5 urban PHC. Do remember this population norm. Very recent exams, they are asking a lot of questions from here. So when you come to this question, they are asking which is correct. Correct for urban CHC, which is correct. We just read in metropolitan city, it should be 100 bed. This is correct. Can we open urban CHC in district hospital, medical college? Answer is yes. District hospital or medical college, district hospital can have urban CHC with medical college or district hospital, because the government said that if you are not getting land for district hospital for urban CHC, if you are not getting land, then you can open it in the same campus where you have district hospital, medical college also. So can have urban CHC in the same campus. The government said less serious patient will go to urban CHC, more serious will go to medical college. But we can open it in the same campus also. So we can open it. And of course, urban CHC is for 5 urban health primary health center, not 2, 3. So it is wrong. It is not at 1.5 lakh. It is for 2.5 lakh population. So this is also wrong. Okay. Chalo. Next question was ki, as a medical officer, if you are in PHC and posted in the earthquake zone area, what you will not do? Never listen to the announcement given by community or senior, because community or senior can give you the instruction ki death is near, start praying. So will you pray or you run? Of course, you will run. You can pray while running also. When the ass is cracked, you can pray anytime. So don't listen to people announcement. Take your own decision. Okay, that's one thing. Then the second last question is, which of the following is not included in the criteria for essential drug? Fixed dose combination is a better than individual drug? No, never. Fixed drug is good for TB treatment, where 4 drugs are in the same capsule, so patient has easy to take. But many a time fixed drugs are unnecessarily given. So fixed drugs combination is not a good thing, because then you have to get the side effect of other drug also. Like most of the people are taking PAN-D, pantoprazole and domperidone. They don't need both. They are just having acidity. So they just need pantoprazole or omeprazole, but they are adding domperidone unnecessarily to prevent the reflux, because domperidone work at the esophageal gastric junction and cause the reflux to have less. So if you don't have reflux, no need to add domperidone. Just take pantoprazole, like that. So fixed dose combination is not good. That part was wrong. Last thing is, in the school health program, whosoever it earlier PHCs used to see and used to give training to teacher, and teacher does screening in school health program. It's not the doctor who does screening. So earlier it was under PHC, now it is also under Ayushman Bharat and PHC is no more. We call it Ayushman Bharat Arogya Mandir. So that's all the recent information. But one last confusing question, that if you are monitoring in a hospital that people are doing good work or not, which thing you should look? You should look at the process. Don't just look at the outcome. Look at all the steps, how the doctor is approaching the patient, how they are discussing. So process is more important, okay, than comparing. And if you're comparing outcome, we call it evaluation. Evaluation means comparing outcome, okay. There are three things: surveillance, monitoring, and evaluation. Monitoring means, suppose you are in a relationship and every day your phone is checked by your girlfriend, boyfriend, that is monitoring. Daily routine checkup is monitoring. Surveillance means your password is already with your girlfriend or boyfriend. So surveillance is close monitoring. And what is evaluation? Your boyfriend, girlfriend don't have the password, so no surveillance. Don't check it every day, so no monitoring. But whenever you meet 1 month, 2 month time, they take the phone when you are in toilet and check out everything in the past. That is evaluation, when they compare the outcome after a fixed gap. So evaluation is comparing outcome. And do remember, there is one thing, goal. Goal is not limited by time. Vision is limited by time, but not goal. And this is a very confusing question they ask again and again. So we have discussed it. Last question, in the bottom up approach, what is the basic unit of implementing from bottom up? The basic unit was subcenter, but now it is no more subcenter. We call it Ayushman Arogya Mandir. So the basic unit of implementation is being changed. This logo they can give, this is the logo of Ottawa Charter. And Ottawa Charter focus on health promotion. So in the Ottawa Charter, they say 5 things, which you can easily remember. If you are the health minister of your country, first thing you will definitely focus is, you will focus on reorienting health services towards village area. So first is reorient health services. Then you will create supportive environment, that water supply should also be good, Anganwadi food should also be good, then health will be good. So supportive thing, reorient health services. Then you will make the people capable of taking decision, develop personal skill. Then you will strengthen the community so that if someone is sick, community can take care of them. And last is, you will definitely build better health policy. You will increase the budget and all. So what are the 5 things that they do in Ottawa Charter? First is reorient health services towards the village. Second is enable person for personal skill also, and enable community. So enable person and enable community. Then reorient health services. Then this is supportive environment should be there. Other ministries should also work so that health is not just from medicine, it's also from food and water. So they should also support. And last is, we should of course make our better health policy. What they word they use the word build health public policy. So better health policy, you will change the budget thing, you will increase and all. So how to remember this all 5 things? Think as a health minister. First, I will make the budget from 1% of GDP to 5%. So I will better the health policy. Then after bettering health policy, I will stop making all these hospitals in city, and I will first focus on primary health center and sub-center in the village. Like Kerala had done 3 MBBS doctor at 1 PHC. That's why the Kerala health system is best. So I will reorient it. Then I will enable people and community so that they can take care of their health. And then I will create the supportive environment so that other ministries should also work together. So this is Ottawa Charter, and that's all from today's discussion. But no discussion is finished without talking the recent updated data. So the data question only come from MMR and IMR. And they have never asked what is the recent data. They just ask what is the target. The target MMR is always less than 70 per lakh. And the target IMR is less than 30 per 1000. But remember, this IMR, infant mortality rate, these are the thing which is not included in global hunger index, and this IMR is also not included in sustainable development goal. So SDG or global hunger index do not talk about IMR. And the target, correct target is less than 70 for IMR, for MMR under sustainable development goal. So what are the other target of sustainable development goal? MMR 70. Under 5 mortality rate less than 25 per 1,000. So simple to remember. Under 5, 25. And neonatal mortality rate less than 12. So you can see half of 25 is 12.5. 25 under 5, neonatal less than 12, MMR less than 70. These are the 3-digit target for SDG. And Ottawa Charter and all we have discussed. But I want to discuss this one thing, that in IMR, MMR, then TFR, total fertility rate. Total fertility rate means total live birth per female. So if they ask per female, it is TFR. But if they say per 1,000 female, then it is general fertility rate. So IMR, MMR, TFR, and one more thing they can ask is under 5 mortality rate. For all these 4, what is the target? They ask in exam only the target. But some people, they will tell you the current status, saying that it is recent and all. In last 30 years, they have never asked current status. So if anyone is teaching you this data again and again, they are useless question. They only ask the target, and that too only of MMR, IMR, already discussed, less than 30 per 1,000. Less than 70 per 1,000. TFR target is 2.1. Every female should produce 2 and 0.1 children. You will say how? Because it's never measured for one female, it's measured for the whole population. Some will produce 3, someone will produce 5 children, someone will produce 1. Average should come 2.1. Why 2.1? Because out of 2.1, 1 will die. So finally we have 2 child per female. Okay. Now under 5 mortality target is 25. Remember, under 5, 5 into 5, 25. Less than 25 per 1,000. So these are the target of 4 things. What is the current situation of India? In current situation, according to the fake data by the fake government of India, we have achieved the target of IMR. It's 25. MMR target is approximately going to be achieved. It's 88. TFR right now is 1.9. So we are producing less children than replacement level. So don't hesitate in producing children. According to Government of India data, population growth is no more a problem in India. Last is under 5. It should be less than 25. It is 29, very close to the target. So that's all from all the target and all the recent update which you can get. If you found this video useful, do share it with your friends and colleagues, because I'm 100% sure at least 2 question, minimum 2 to 4 question will come from the part which we discussed here. And these all are recent parts, so they might not have covered it. So help your friend also, and do revise it one time before exam also. Love you all. Keep enjoying your life and focus on the journey. Be recent. Don't think too much of future or past. Be in the present. Love you all. Bye-bye.